So, for some of us that were born in the late 1900s, you must have heard the story of a child born with Quran in his hands. That is the same way most Nigerians were born with drugs in their hands. You get people who say, if you shook them pain for body, na drugs will they fall out. If you stab them, instead make blood come out, na drugs will they see. This brings me to my topic of discussion today: self-medication. Have you ever wondered why a particular species of Nigerians always know the right drug to use for everything happening to them? Now, let me answer that for you. When some people were giving birth, it was inscribed on their forehead, pharmacist. Some medical doctors. And most of them are our parents. So most of these people, they are our parents, because most of us learned self-medication from them. I know most of us can actually relate to this, because I, for one, I can remember when I was a child. Once I have a headache or fever, my mother would just give me one, oh yeah, you go malaria, or biaki go malaria. All these things are what we call self-medication. Now, let me explain the definition of self-medication according to the dictionary. If you go to your dictionary, or maybe you pick up your phone and Google, they will tell you that self-medication is the use or purchase or misuse of drugs or medications without prescription from a medical doctor or a healthcare professional. Now, a lot of things can make us to self-medicate. One, for example, is maybe lack of time. Another can be inaccessibility to healthcare professionals. Most of us, we self-medicate because we don't have contacts or a relationship with a proper healthcare professional or a medical doctor. So now I'm going to tell you guys why you should not self-medicate. Now, number one, self-medication can make us or make you Nigerians to leave underlying diseases untreated. What do I mean by this? Now, for some diseases that share the same symptoms, for example, hypertension, malaria, fever, they all share a common symptom called headache. Now, when you have headache and you just assume that, okay, what is causing this headache is malaria, you now can buy malaria drugs. Meanwhile, what may be your problem might be hypertension. Now, you see that when you take the malaria drug, the headache will go, but as time goes on, it will come back. The same thing goes for maybe when you take painkillers. The headache will go, but you notice that within a few days, the headache comes back. That is because you only took care of the symptoms but not the actual cause of that symptom. Now, not only that, stress can also cause headache. Now, when you have an headache that is caused as a result of stress, all you need to do is lay down and have a rest. But some of us have gotten used to taking drugs for any little or slightest thing that happens to us. Now, when you have an headache as a result of stress, and you go ahead and keep on taking ibuprofen, keep on taking other painkillers, it can lead to liver damage as a result of toxicity. Besides that, it can also lead to antimicrobial or antibiotic resistance, or let me use the general name, antimicrobial resistance, whereby you keep on taking drugs to treat a certain disease that is not there, to the extent that when you now have such disease, those drugs no longer work for that disease. Another scenario is stomach ache. So most of us Nigerians have grown with this mindset that whenever we have a stomach ache or stomach pain, we assume that it is warm. So immediately we have stomach ache, your mom will be like, "You got go warm. Any small thing in your stomach, you got go warm. Where's the making for? You got go warm." Forgetting that there are a lot of gastrointestinal diseases that can cause stomach pain. Diseases such as ulcer, appendicitis. There's even the common one that usually happens to children called hernia. All these things can lead to stomach upset, stomach pain, stomach ache, whichever one you deem fit to call it. Now, you see that whenever you have a stomach pain, and the cause of that stomach pain is because you have ulcer without your knowledge, and you went and take ogworm, if you're to tell yourself the truth, instead of you treating the problem, you are actually causing a problem to yourself. Because for someone that has ulcer, you are not required to take any form of warm medicine, because ulcer is commonly caused by the bacteria known as Helicobacter pylori. So when you take a warm medicine, maybe metronidazole, to treat a stomach pain caused by Helicobacter pylori, you only cause more problem to your intestines, because first of all, you are not treating the ulcer. The Helicobacter pylori keeps on feeding in your intestines. Secondly, the drugs you take for hookworm, as it is being metabolized, it causes toxicity and damages your liver. So there are a lot of disadvantages that can be attributed to self-medication. A lot of problems can be attributed to self-medication, and we all should be careful not to take or treat diseases that are not there. Instead, always seek professional advice from your medical doctor or a pharmacist or any healthcare professional. Now, I hope you've learned something or two in this video. Do well to subscribe, like, share, and click on your notification button so that you can receive more of videos like this. Thank you and stay safe.